Last week, Dr. Ryan went over what you should expect from your first visit in our office, that new patient exam. And today we're going to go over what you should expect for your second visit, that first follow-up appointment. The most important thing that we want to know from you is, how are you doing? Do you feel better, worse, or exactly the same as when you first came in at that last visit? Any of these options, whether you're feeling better, worse, or no different, will provide us with a ton of information about what's going on, what might be contributing to your symptoms, and it helps us to give you a more accurate diagnosis and then better direct your care. If a patient comes back in for their day 2 appointment and they're feeling significantly better, great. That helps us know that whatever intervention we used on your first appointment is really what the body needs, and we can keep running in that direction to optimize improvement as fast as possible. If you come back in on your second appointment and you're feeling worse, this can seem like a bad thing, but again, it provides us with a lot of information. We're not going to keep doing the same thing if you're getting worse. That would be crazy. But instead, we'll often need to switch directions, almost do like an opposite approach, and often patients will then start to feel significant relief very quickly. The third option would be if you come in for your second visit and you're feeling exactly the same, no better, no worse. If this is the case, then we know mechanically we're not really having much of an effect on whatever is contributing to your symptoms. So we need to do a little bit of rethinking, kind of reformulate a treatment plan to help you feel good as soon as possible. We don't expect to need 8 to 12 visits before we see any measurable improvement with care. If we give the body the movement, the control, the stability that it needs, generally we see very quick improvement. So even though we don't expect you to leave here on your first visit, even the second, 100% better, we do expect to see significant improvement in how you're feeling, usually within 2 to 4 visits, which is usually within a week or 2. The reason we use a day 1, day 2 approach is because we want to control our variables and really figure out what's going on. Even though we have a lot of tools in our tool belt as far as treatment goes, like adjusting, dry needling, muscle release, various exercises, if we were to throw all of that at you day 1, more of that shotgun approach, we really don't know what's going on. It makes it much more difficult to get an accurate diagnosis. It can actually delay your response to care if we're not very focused on the front end. So we prefer to take a more precise approach, figure out exactly what's going on. After we've gone over that initial response to care, we'll then go over a condition report with you. This is a document that has more information about what's going on, what's causing your pain, more of that diagnosis type information. Some patients want to know as much as they can about what's going on. Some don't care as much. So this just provides some extra information, and it's a take home for you, so you can take home and read it at your leisure. This condition report also includes a roadmap for care in our office. So it'll include any treatments that we think that would be particularly helpful for you, as well as how many visits and how frequently we expect to see you in order to see the best improvement as far as pain relief and help you meet your goals. We think it's incredibly important for patients to understand what's going on, because if you understand specific pain triggers, what's going on with your body, you'll feel a lot more control over what's going on, but we also see much better outcomes and faster improvement. If you have no idea what's going on with your back pain or why it's happening, and you continue to do aggravating activities or be in positions that cause you more pain, we're going to see a delayed response to care. So we really think there's a lot of value in this condition report and explaining things to patients and helping them understand really what's going on with their bodies. The last part of your second visit in our office is a more comprehensive treatment. Once we've effectively diagnosed what's going on and know what specifically is causing your pain, we can then hone in with more specific treatments that are going to help you improve as fast as possible. Treatments can include things like normal adjusting or joint manipulation. We can do more gentle joint mobilizations, dry needling, cupping therapy, scraping, and various exercises, all geared to help you, 1, feel better, but 2, also become a more resilient person so that you're more likely to have these pain complaints stay away long term. Everything with treatment is custom tailored to you, so what you receive for back pain might be completely different than what your neighbor receives for a complaint in the same area. No bodies are the same, so every treatment is going to be, again, specifically for you, and we're going to expect to see things change as you progress through care. So we're not going to be doing the same exact exercises on day 2 as we are on day 8 or day 12. We expect to see progression, and we'll also push things so that you continue to load your body and continue to improve.